question for Dr. Woganee Filate. Is it safe to take melatonin every night to help with sleep, or is there something else that you might consider taking?
Great question. So I always say, especially in sleep medicine, we get more bang from our buck from our behaviors and what we do to really set ourselves up for good sleep. A lot of times we tend to rely on medications, whether they be prescription or supplements, but really starting with a solid sleep base. So making sure your sleep routine is regular, going to bed the same time every night, cutting out your screens before bed, being mindful that alcohol is a sleep disruptor, caffeine can impact sleep. But if someone, let's say, is doing all of the things that they're doing the right things, quote unquote, and they still feel that they're not optimized with their sleep, I don't have a problem with melatonin. Until we have data that tells us that it's harmful and patients find that it helps, they can continue. The data is a bit weak about the benefits of melatonin. Some studies have shown a very small improvement in improving sleep. But again, like I said, in the absence of evidence that says that it's harmful, patients can try over-the-counter melatonin. What I have found in my clinical practice is that the benefits of melatonin are really time limited. So you may get a lot of noticeable effects in the early use of the medication, but with regular use, the effect wanes. So it's just something to keep in mind. Another common supplement patients will often tell me they use for sleep is magnesium. Actually, the evidence of magnesium is even less robust than melatonin. It's really good for people who have nocturnal leg cramps and things like that. But again, if patients find that it helps them sleep and they don't have side effects, I don't have a concern. But I never want that to be in replace of the good sleep habits that you should be doing night after night.
This has been a LUME Minute, a collaboration between This is Perimenopause and LUME Women's Health. Have questions that you want answered? Drop us a note in the comments or send us an email to hello@thisisperimenopause.com. Please note this information is not intended as medical advice. The intent of this information is to provide our listeners with knowledge to support more efficient and effective communication with their medical providers.